During each detailed organ exam, tissues will be collected for histologic evaluation and microbiological testing. To collect a histology sample, use your knife to resect a small slice of tissue no more than 1 centimeter thick. Immediately, place the tissue into the formalin jar for fixation. There are 2 methods for collecting a microbiology sample. In the first method, a fresh piece of tissue is placed in a plastic bag and submitted to the laboratory where microbiology samples will be taken directly from the sample. The alternative method is used if the examiner believes a sample may be heavily contaminated. The sample is not expected to arrive at the laboratory within 24 hours, or the examiner has reason to suspect an anaerobic bacterial infection. In these cases, it is advisable to place an additional microbiology sample into anaerobic transport medium within 45 minutes of the animal's death. In this procedure, use a small propane torch to heat a metal spatula until it is glowing hot. Sear the outside of the tissue to eliminate any external bacterial contamination. Using a new scalpel blade, make a stab down into the tissue. Insert the swab into the incision to collect your sample. Withdraw the swab and remove the cap of the portical tube, being certain to avoid tilting the open tube, which will release the gas lock. This gas lock prevents air from entering the tube. Insert the swab down into the transport medium. Leave the swab in place and firmly replace the cap. Do not refrigerate or chill this tube after it is inoculated. In addition, there may be an indication to inoculate other transport medias if the differential diagnosis strongly indicates specific agents which are difficult to isolate or identify. Your diagnostic laboratory may recommend the use of particular diagnostic transport medias as an adjunct to sample collection.